Hi, I'm Flavia Azania, and in this video, we're going to talk about female infertility due to tubal factor. We'll discuss what it is, its causes, its diagnosis, and its treatment. We'll also provide detailed answers to the most commonly asked questions that users may have related to this topic. The fallopian tubes must be permeable and have the ability to move to carry out their function correctly. Their function consists of picking up the egg released by the ovary, allowing it to meet with the sperm and fertilization to occur. And finally, transporting the embryo to the uterus, where it must implant to lead to pregnancy. Therefore, the function of the fallopian tubes is essential for a natural pregnancy to occur. In this way, tubal factor refers to alterations in the fallopian tubes that hinder or even prevent pregnancy. Sometimes, a woman only presents with a unilateral tubal factor, meaning only one of the tubes is affected and the other is healthy. In this case, a natural pregnancy can occur, although the chances of achieving it may be reduced, thus lengthening the time it takes. When the tubal factor is bilateral, both tubes are damaged. Therefore, natural pregnancy is not possible as the meeting between egg and sperm is prevented. A patient with bilateral tubal involvement will generally have to resort to assisted reproduction if she wishes to be a mother. And before continuing with the content of this video, I'm going to ask you please, if you're liking it, to give it a like and subscribe to the channel if you haven't already, as you help us a lot to continue, and so that all the information we publish can reach more people. Although sometimes unknown, the involvement of the fallopian tubes can be due to different causes. One of them would be pelvic infection, the most frequent cause of tubal injury. This type of infection can originate in the reproductive system or in nearby sites such as the appendix. Among the responsible microorganisms are chlamydia and gonorrhea, both causes of sexually transmitted infections. If these infections are not treated properly and on time, the inflammatory process, pelvic inflammatory disease, will trigger the appearance of adhesions. These adhesions can affect tubal functionality, thus potentially causing fertility problems due to tubal factor. Adhesions are made of scar tissue that forms between the pelvic organs and can cause them to stick together and lose their functionality. Another cause would be endometriosis. Endometriosis is a disease in which endometrial tissue is present outside the uterine cavity. It implants in other locations, such as the fallopian tubes or the ovaries. Therefore, endometriosis can cause tubal obstructions and also pelvic adhesions that hinder the mobility of the fallopian tubes. You can read more about this pathology in the link I've left in the tags and in the description. Another possible cause would be hydrosalpinx. It's an alteration of the fallopian tubes characterized by the accumulation of fluid inside them. This causes the tube to dilate and, furthermore, to become obstructed. The most common cause of hydrosalpinx is a previous pelvic infection. Additionally, it can affect the pregnancy rate after in vitro fertilization, IVF, and the fluid that accumulates in the hydrosalpinx can reach the uterus and thus affect embryo implantation. You can get more information in the article I've left in the tags and in the description. There would also be other aspects that can impede the functionality of the fallopian tubes and thus be a cause of tubal factor. Previous pelvic surgeries, as they can cause adhesions that limit the activity of the tubes. Ectopic pregnancy, resulting in removal of the tube, salpingectomy, tubal ligation, and, although rare, congenital malformations of the tubes. Any alteration in the fallopian tubes that affects their permeability and freedom of movement is a cause of tubal factor infertility. In most cases, problems in the fallopian tubes don't cause symptoms that the woman can perceive. Therefore, tubal factor is often diagnosed when a couple has been trying to conceive for some time without success and proceeds to have a fertility study. The permeability of the fallopian tubes can be evaluated through the following diagnostic tests. Ultrasound. It is performed routinely in the gynecology office, but this test is only capable of detecting a large hydrosalpinx. Hysterosalpingography. It is the most commonly used test to check the permeability of the fallopian tubes. It consists of introducing a contrast liquid through the cervix to observe its path toward the tubes as X-ray images are taken. If there were any obstruction in the tubes, the contrast liquid would get trapped and be seen in the images. Hydrosalpinx. This test is similar to the previous one, but a saline solution or a gel is introduced through the cervix instead of the contrast liquid. Additionally, in this case, the use of X-rays is replaced by ultrasound. Laparoscopy. It is a surgical intervention in which, under general anesthesia, small incisions are made below the patient's navel. This allows for the insertion of a small camera to observe the fallopian tubes, as well as their relationship with the rest of the structures in the pelvic cavity. Usually, a laparoscopy is not performed solely for diagnostic purposes, but also surgically to correct any possible alteration found. Because of this, laparoscopy is usually only done if endometriosis, some adhesion, or another issue that can be surgically fixed right then and there is suspected. Treatment for fallopian tube conditions will depend on the underlying cause. Bacterial infections must be treated with antibiotics. However, if the fallopian tubes are already damaged, the medication will treat the infection, but it won't be able to fix the damage caused. On the other hand, it will also be important to consider whether the tube involvement is unilateral or bilateral. In the case of unilateral tubal factor, natural pregnancy would be possible, although the chances may be reduced. However, the couple can turn to assisted reproduction techniques if they have difficulty achieving pregnancy. Since in these cases only one tube is damaged, artificial insemination or in vitro fertilization, IVF, could be indicated. The choice of one assisted reproduction technique or another will depend on the specific situation of each woman or couple. In the case of bilateral tubal factor, if both fallopian tubes are affected, surgery to repair and recanalize the tubes would be possible, depending on the cause of the blockage and its severity. However, it can be difficult for the woman to fully regain her fertility after the procedure. And that's because fallopian tube repair is a complex surgery. For this reason, many women with bilateral tubal factor turn directly to assisted reproduction to become mothers. Specifically, the treatment that doesn't require tubal functionality to achieve pregnancy is IVF. Despite this, in cases of hydrosalpinx, surgery to remove the damaged fallopian tube is recommended. This procedure, called a salpingectomy, would be performed prior to the IVF cycle. This would increase pregnancy rates, as it would prevent the flow of accumulated fluid into the uterus. You can find all the details about IVF in the article I've linked in the tags and in the description. And now we're going to answer the most frequent questions that users may have related to this topic. What is the best solution to achieve pregnancy with blocked fallopian tubes? When both fallopian tubes are blocked, depending on the cause of that blockage, it might be possible to perform surgery to try to restore tubal functionality and patency. However, it's a complex surgery that isn't always successful in allowing the woman to subsequently seek pregnancy naturally. Therefore, in many cases, people turn directly to in vitro fertilization, IVF-RF. It's an assisted reproduction technique that doesn't require tubal functionality to be successful. What symptoms can a fallopian tube blockage cause? A fallopian tube obstruction doesn't actually cause symptoms on its own. However, the underlying cause that led to that tubal blockage can also produce other symptoms. That's the case with infections, which can cause abnormal vaginal discharge. Or, for example, endometriosis, which is characterized by causing very painful periods. We'd really love to hear about your experience, so I invite you to tell us in the comments.